Today we'll take a look at the step-by-step process of in vitro fertilization or IVF. IVF involves multiple steps. The very first step is called ovarian stimulation. In a normal menstrual cycle, only one egg is produced. However, when we do IVF, we need multiple eggs. The way we do this is by giving hormone injections called FSH. These are simple injections without any major side effects. So we start these injections usually on day 2 of the menstrual cycle, and they are given for about 9 to 10 days. And during this process, for monitoring, we do ultrasound scans so that the monitoring, so that we are able to monitor the follicles and we know when they are going to reach the mature size. So once these follicles reach the mature size, we are going to give a trigger injection which is called HCG, which helps in the final stages of maturation. So once this injection is given, 36 hours later we can do the process of what is called egg collection. So now coming to the second step, which is called egg collection, this is done under sedation. The important thing to remember is this is not a surgery, this is a very simple procedure. So how we do it is under ultrasound guidance, we pass the needle through the ovary and then collect the eggs out, and these eggs are then stored in the incubator. So once we collect the eggs and the patient comes out of anesthesia, there are no cuts and stitches, and so there is no pain once you come out of the anesthesia. So it's a very simple process. So now let us move on to the third step. The third step, the same day as when we do the egg collection, we also request the male partner to provide a sperm sample. We prepare the sperm sample with a specialized process so that we are able to separate the motile sperm, highly motile sperm, from the rest of the semen sample which has got the debris and the non-motile sperm. This motile, high concentrated motile sperm is then stored in the incubator for fertilization. So now the fourth step is called fertilization process. In conventional IVF, what we do is we mix egg and sperm in a culture dish so that the sperm is able to get into the egg on its own to make the embryo. Whereas there is an additional advanced technology called ICSI. Here we inject one single sperm inside the egg, and this is usually advocated for couples who have very low sperm count or motility. So either whether we do IVF or ICSI for fertilization, the embryo is formed the next day, which is 24 hours later. So the next step in the process is called embryo culture or embryo growth. So this formed embryo grows in the lab up till day 5. So anywhere from the point of egg collection 2 to 5 days later, we are able to do the process of what is called the embryo transfer. But during this process of embryo culture, our scientist or embryologist takes a look at the embryo every day to check for two things. One is the cell number and the cell quality. So this helps us decide as to when the embryo transfer process can happen. So now coming to the next step, which is the embryo transfer process. This is a very simple process. This is not done under anesthesia. A small narrow plastic tube which has got the embryos loaded in it is introduced into the uterus and is deposited at the top of the uterus so that these embryos can implant and give a possible positive pregnancy. So the embryo transfer process is very simple process. So now we have seen the 5 steps in the IVF process. Just to reiterate, the first step is called ovarian stimulation, where we create multiple eggs, and the second is the process of collection of these multiple eggs, and the third is the process of collecting the sperm sample from the male partner and preparing it. The fourth is the process of fertilization, and the fifth is embryo culture, and the last process is the embryo transfer process, where the embryo is replaced inside. So this we call it as the IVF process. But the last part, which is the waiting time of 10 to 12 days before we get to know whether this cycle has worked for you, is the challenging step for the couple. So during this time, we provide them guidance and support, and we also have a psychologist on the team who is going to help you with the to help you emotionally during this very difficult part of the journey in an IVF cycle. So to reiterate, one IVF cycle is 1 month, in which the first 2 weeks is the active process, where all these procedures happen, and the second half is when you wait for the treatment process to see if it has worked for you. So thank you very much for joining me today in this explanation regarding the IVF process. If you have any doubts or queries, please reach out to us at Mother to Be.
Like and subscribe Eagle Health and Beauty.